Ladies and gentlemen, welcome and thank you for joining today's webinar, Overview of the U.S. Veterans Benefits Administration. Before we begin, please ensure you have opened the chat panel by using the associated icon located at the bottom of your screen. If you require technical assistance, please send a chat to the event producer. Please note that all connections are muted until the Q&A portion of the call. We will provide you instructions on how to ask a question at that time. You may submit a written question at any time by selecting all panelists from the drop-down menu in the chat panel, enter your question in the message box and send. This webinar is being recorded and the recording and presentation slides will be emailed to the attendees. With that, I'll turn the call over to Christopher Taylor, Acting Deputy Director for the Field Policy and Management in the U.S. Department of Housing and Urban Development. Please go ahead.
Thank you so much, and good afternoon, everyone, and welcome to today's webinar. Today's webinar is co-hosted by the United States Department of Housing and Urban Development and the U.S. Department of Veteran Affairs. As the just heard, my name is Christopher Taylor, work in the Office of Field Policy and Management, which oversees the Department's place-based initiatives, including the EnVision Center demonstration. As a designated EnVision Center site, HUD commits to you that we will help enhance the services that you provide to your communities under the 4 pillars of self-sufficiency, economic power, educational advancement, health and wellness, and character and leadership. I personally want to thank you all for your continued service and hard work to help your communities and partners during the ongoing pandemic and economic and social challenges. We appreciate our federal partners at the VA for being available to talk with our EnVision Center site today about the Veterans Benefits Administration. Many of you serve veterans or are veterans yourself, and we thought it was important to highlight the critical resources and services that the VA offers. We are hoping the knowledge shared by our presenter today will help enhance how the EnVision Center serve their communities. Without further ado, I have the honor of introducing Julian Wright from the VA's Veterans Benefits Administration. Mr. Wright is the Foreign Services Program Manager and Minority Veterans Program Manager with the VBA. Mr. Wright is an Army veteran and an employee of the VA for over 25 years. During his career, Mr. Wright has worked as a vocational rehabilitation and employment specialist at the Washington VA Medical Center, where he assists veterans who were diagnosed with severe mental illness in Operation Enduring Freedom veterans who were diagnosed with PTSD and traumatic brain injuries find and maintain private sector and government employment. He has also mentored new Veteran Services Representatives employees. Mr. Wright, I thank you for your service to this country and taking time to present today to our EnVision Centers and HUD staff. Mr. Wright, please take it away.
Thank you so much, Christopher. And I also wanted to thank Romel and Jill for reaching out to me to do a presentation to HUD, because one of the things that we do at the VA is we always try to find veterans and their family members to ensure that they are aware of the benefits that they're entitled to receive. So I definitely want to take a moment to thank you all for inviting me today to present. I will be providing you with a brief and general overview of VBA and the benefits and services that are available to service members and veterans for their military service. Now, if you want to learn more about VA, please visit the Department of Veterans Affairs website at www.va.gov or www.benefits.va.gov to learn about the benefits that I'll cover today. Next slide. So VA is the second largest agency behind the Department of Defense. There are 3 administrations within the Department of Veterans Affairs. We have the Veterans Benefit Administration, which I'm a part of. We have the Veterans Health Administration, VHA, and then we have the National Cemetery Administration, NCA. And each of our administrations has its own mission in caring for service members, veterans, and dependents. So, for example, VHA is primarily responsible for providing health care to veterans at its over 1,250 medical facilities, to include 170 hospitals and 1,074 outpatient sites. One of the things I just wanted to note with the Veterans Health Administration, you can see just the number of areas that they cover. We have the community-based outpatient clinics, what we call CBOCs, and these clinics are actually in the community, closer to veterans where they don't necessarily have to travel long distances to VA medical centers. And then we have vet centers who are primarily for veterans who have been deployed and have seen combat. They can actually go to vet centers and receive counseling. Also, family members can receive counseling as well. We have our women's clinic, and then we also have a homeless veteran program at the Veterans Health Administration. Now, one of the things to note about the homeless veterans program, we do partner with HUD, with our HUD BASH program. And so basically what the HUD BASH program is, we provide vouchers to homeless veterans where they can find a home and basically take them away from the living situation, or more a stable living situation. And then for the NCA, they are primarily responsible for providing the final resting place for veterans and their eligible family members. Now, NCA has over 145 cemeteries in the states and also in U.S. territories. They also provide headstones and markers, as well as presidential memorial certificates, which are provided to family members, which express heartfelt thanks for the veteran service. Next slide. And then there's the VBA. And so our VBA mission is simply to serve as an advocate for service members, veterans, survivors, and dependents, and deliver benefits and services that honor their service and assist in their readjustment, enhance their lives, and engender their full trust. As noted on this slide, VBA has over 23,000 employees, with most of which are veterans that are employed. VBA has a claims processing centers across the country. As you can see, we have 56 regional offices, and these regional offices are primarily, again, responsible for processing disability and compensation claims, which I'll talk more about a little in the presentation. Also, our veterans readiness and employment claims. So they have some very important missions in caring for veterans. Some of the other things that we have special processing centers, and then we also have call centers where veterans' claims can be processed. Next slide. So this map depicts the location of VBA offices to include the regional office, which we do have one that's located in Manila, Philippines. First, the VBA has 4 district offices located in the Pacific region, the Continental region, the Southeast region, and the Northeast region. And so these districts are actually managed by a district director who has oversight of the VBA offices within their district. As noted in the previous slide, there are 56 regional offices and 35 special processing centers. Now, one of the things I wanted to note, and it may be a little difficult to see on this particular slide, but we have specialized offices that process claims. For example, claims for education, we have two education processing centers that are located in New York and Muskogee, Oklahoma. We have an insurance center that processes primarily our insurance claims. They are located in Philadelphia. And then we have our loan guarantee processing centers, and we have 8 of those locations. And then we also have 8 call centers, which are spread out across the country. Next slide. So this office is the office that I'm a part of, which is the outreach and stakeholder engagement. And so our primary function is to make sure service members, veterans, family members receive accurate and up-to-date information on benefits and services offered by VBA. Now, typically we do outreach face-to-face, but of course with the current situation, we are in most cases doing outreach via virtual or telephonically, as we're doing today. In addition, our office manages the special emphasis outreach programs at the national level. However, outreach coordinators at our regional office are the ones that actually conduct the outreach in their local communities. And then we capture this outreach data, which is extremely important because it helps us to determine where we need to concentrate our efforts. So data is important, as I mentioned, because we actually report the outreach data to our senior level leadership, the Secretary's office, and then we also report our outreach to Congress. So we definitely have to make sure when coordinators are reporting or when we are out doing outreach that the information is accurate. Next slide. As I mentioned, the special emphasis programs are managed by analysts in my office. And it's the program managers that provide oversight and guidance to the regional office coordinators. So we have 14 special emphasis programs that are highlighted on this slide. And I just wanted to go over a few of them just to give you an idea of what's involved with the program management aspect of it. So we have the casualty and survivor coordinator. And again, the program manager is in my office. And so basically the coordinators work with the branches of service. That's the Army, Navy, Air Force, Marines, and the Coast Guard. And so basically they work with these branches to provide information about benefits and services to family members of a service member who has died on active duty. Next we have our elderly program, and the elderly program outreach coordinator provides outreach and VA benefit information along with claims assistance to elderly veterans who are age 65 or older, and then also to their survivors. And then we also have the homeless program, which is a really important program within our office. And basically our mission is and has been to end veteran homelessness. And that is a VA top priority, and it has been that way for several years now. And so VBA has made great strides with claims processing and then outreach to homeless veterans. Coordinators who are at the regional office work both with our internal and external stakeholders to assist veterans who are homeless or who are at risk of becoming homeless. And then we have our justice involved, and we often partner with our state, county, local governments, and nonprofit organizations to develop best practices to allow regional offices to increase access and outreach to incarcerated veterans. Now, one of the things I also wanted to note is the program that I manage, one of the programs that I manage, which is the minority program. And actually, this program was created or initiated by a public law. And so basically with the public law, we provide assistance to African American veterans, Asian, Pacific Islanders, Native American, Alaskan Natives, and Hispanic veterans with accessing VA benefits. We also work with our tribal and Native American veterans. Just recently we had some campaigns where we have been doing virtual webinars for tribal communities just to make sure that they are aware of just the different benefits that we offer. So that's what we've been doing and continue to do until we are able to actually go out and do face-to-face outreach. Now, for the next slide, we're going to, next slide.
This is the slide, or do you want me to advance?
Yeah, no, this is fine.
Sure.
So, I'm sorry. Disability compensation is a tax-free monthly benefit paid to veterans who are disabled by injury or disease that was incurred or aggravated by their active duty military service. Now, the key to this benefit is that the injury or disease must have resulted from their active duty military service. So in VA terms, it must be service-connected. It is also important to note that VBA can award disability compensation for both physical injuries and psychological issues, such as post-traumatic stress disorder. In addition to having a disability that's service-connected, the veteran must receive a discharge other than dishonorable from service to be eligible for this particular benefit. There are multiple factors that determine the disability amount or the amount that a veteran will receive. These factors include the degree of the disability, and these are usually rated at 10% or more, how many dependents that the veteran has, and usually the veteran can add their spouse, their dependent children, children that are under age 18 or younger, or if they are attending school beyond 18 years old, if they're going to college, for example, that's up to age 23. And then finally, the severity of the disability. Next slide. The next benefit that I will discuss is insurance. Now, VA life insurance benefits were developed in consideration of the extra risk involved with military service. VA insurance begins in service and can continue if transitioned to a veteran's life insurance program for the veteran. VA offers several different types of life insurance. One, they offer the service member a automatic coverage under the service member's group life insurance, or which we call SIGLI, when they enter the active duty. And this coverage remains in place 120 days after their separation date from the military. But it also can be extended up to 2 years after separation. Service members' group life insurance also includes an automatic coverage for spouses and children of service members for a premium, and this is called the Family Service Members Group Life Insurance. Next slide. Now, service members group life insurance also includes an automatic coverage for service members who suffer a severe loss, such as amputation, blindness, or a traumatic service-related injury, and this is called traumatic injury protection. So depending on the type of loss, will actually determine the amount of payment the service member will receive. And so it actually starts off at $25,000 and it maxes out at $100,000. Service member life insurance can be converted to a civilian program called the Veterans Group Life Insurance. And this can be renewed for life under the certain conditions, including separation from the military or acquiring a disability. If a veteran wants to convert SGLI to VGLI, he or she must do it within 1 year and 120 days of separation from the military. No health review within the first 240 days from separation. Anything after that, they will require a health review. VA also offers other insurance-related programs, such as the Service Disabled Veterans Insurance. And this program offers service-connected veterans a supplemental insurance policy, and this is actually implemented in up to $10,000. And then we have the Veterans Mortgage Life Insurance, which is a mortgage protection insurance that helps families with severely disabled veterans pay off their home loan in the event that the veteran passes away. Now, the Veterans Mortgage Life Insurance is only available to service members and veterans with a service-connected or severe service-connected disability and who have been awarded a special adaptive housing grant. And I'll speak a little bit more about the special adaptive housing grant a little bit later in the presentation. And one final thing about the Veterans Mortgage Life Insurance, the veteran must apply for the Veterans Mortgage Life Insurance before they reach the age of 70, their 70th birthday. Next slide. So our next benefit is our education program. And so VBA has education programs for eligible service members and veterans, primarily for the assistance for tuitions, books, fees, housing, and on-the-job training. And these programs are the Post-9/11 GI Bill, which some of you may have heard about, the Montgomery GI Bill for the active duty, the Montgomery GI Bill for the selective reservists, National Guardsmen, and then there's the program for the Reserves Educational Assistance Program, which is also for reservists and guardsmen. So eligibility for the Post-9/11 GI Bill is based on the length of service, and from after September 10th, 2001, is actually when the Post-9/11 GI Bill was, veterans were able to take advantage of it. The Post-9/11 GI Bill offers a host of benefits for service members and veterans. So, for example, if a veteran is going to school, the Post-9/11 GI Bill pays the institution directly. So the veteran doesn't necessarily have to get involved with the payments of the tuition. Also for books and fees, again, Post-9/11 GI Bill takes care of those incidentals. And then we have the Montgomery GI Bill, which is for active duty, and a 2-year commitment is required for, at the minimum, is required for this particular education benefit. Now, in order for a veteran to take full advantage while they were serving, they must have a dedicated $100 a month for 12 months in order to be eligible for this particular education benefit. And then, as I mentioned, the Montgomery GI Bill is for selective reserves. They must meet a 6-year obligation in order to be eligible for this particular benefit. Now, one thing to note is in some cases, veterans can be eligible for multiple education benefits, but it's basically up to the veteran to determine which education benefits that would benefit them the most. So we encourage them to go on to our webpage, and there's an education, a comparable education program that they can use to basically help them with comparing education programs that you know, and it'll show them which program that suits them. So the next slide, we have the Henry W. Comery Veterans Education Assistance Act, which was passed into law August 17, 2017. And basically what this law did was it opened up a lot of provisions that would benefit veterans. So, for example, with the Post-9/11 GI Bill, before this law, veterans that were utilizing the Post-9/11 had 15 years from the time that they got out of the military to use the Post-9/11 GI Bill. But with the enactment of this law, it basically eliminated that 15-year, the eliminating date of 15 years. So veterans who served January 1st, 2013 and after, they will be eligible for this 15-year limitation or the eliminating date. So basically with that, the 15-year is basically eliminated. And so there are other many provisions that came from this, and as I mentioned, it was very beneficial to veterans who were actually using their education benefits. Next slide. So with the home loan benefit, so this is a benefit that are offered to veterans, and one of the things that we, talk to veterans, up front is, the VA doesn't actually loan the money, but we guarantee the portion of the mortgage, which enable the veteran to find a lender and have more favorable terms to their loan. So eligibility for the VA home loan benefit is contingent on service requirements and for housing rents or having a service-connected disability. So generally, veterans must have served 90 days of total or 180 days, continuous days, depending on when they qualify. And then National Guard and Reserve members generally have to serve 90 days on active duty or 6 years in Selective Reserve or National Guard to be eligible for the home loan benefit. And so basically, once they qualify based on their service, they'll be able to qualify for a certificate of eligibility. And generally when they are trying to find a lender, they will provide this certificate of eligibility to their lender. And basically with that, the lender will know that their loan will be backed by VA. Next slide. And so one of the other programs that we have that falls under the Home Loan Guarantee Program is the Native American Veteran Direct Loan. And so this program actually provides eligible Native American veterans and their spouses the opportunity to use their Department of Veterans Affairs Home Loan Guarantee to use their benefit on federal trust lands. And so usually what has to happen, the Native American tribe has to have MOU, a Memorandum of Understanding, with the Secretary of the VA. And what this MOU spells out is the conditions under which the program will operate on that federal trust land. Next, we have, in addition to the Veterans Guarantee Home Loans, veterans with service-connected disabilities can apply for a housing grant to purchase, build, adapt a primary residence for personal occupancy or to accommodate their disability. So basically, if a veteran needs to make alterations to their home because of their disability, whether they need to put a ramp in or widen the doorways for if they're in a wheelchair, they can use this special adaptive housing grant to do those alterations. And then VA provides these grants to service members, particularly if they have a permanent and total service-connected disability. Next slide. So the next benefit I'll talk about is our Veterans Pension Benefit. Now, there are several eligibility factors to receive a pension, and they include the age, the disability, income, and whether the veteran's military service was during a wartime period. Now, service requirements vary depending on which wartime period the veteran served during. If the veteran served before September 7, 1980, he or she must have served 90 days on active duty. Otherwise, the veteran must have served 24 months on active duty or the full period for which he or she was called to active duty. Now, if the veteran meets the service requirement, he or she has a limited income, then they can be eligible for the veteran's pension. Now, in the case that they are over 65 or older, they don't necessarily have to provide anything regarding a disability. However, if they are under age 65 or older, they must show that they have a permanent and total disability. Now, one of the things that we do look at, as I mentioned, is the veteran's income. And so the term limited income refers to the amount of income which has been set by Congress on an annual basis. So, for example, a single veteran, to be eligible for a veteran pension, cannot make more than $12,356 annually. And so basically with that, we will take a look at any income that the veteran has, whether it be Social Security income, whether they have other pension income coming in. We will count that as their income. And then we also assess the veteran's net worth. Next slide. So for our next program, I will discuss the Veterans Readiness and Employment Program. Now, traditionally, the VA and HUD program assists veterans that have a service-connected disability with maintaining, obtaining suitable employment. Now, there are two important notes that I need to make about the VA and HUD program. It also provides career counseling service for recently separated service members, and it provides assistance with finding employment, with resume writing, with interview prep. So this is one of the features that VA and HUD program also offers veterans. So to take a look at the eligibility requirement, veterans must use their VA and HUD benefits within 12 years from the discharge or from the first date that they were notified of their service-connected disability. Now, so service members are eligible for the VA and HUD program. And so if they are getting ready to be medically discharged, they are pretty much participating in what's called the Integrated Disability Evaluation System. And so if they are participating in this particular program, they will automatically be entitled to receive VA and HUD benefits. And then for our service members, again, they will qualify based on whether or not they are in the IDES program. VA and HUD offers up to 5 tracks that a veteran or service member can go into. And basically those are the reemployment, the self-employment, employment through long-term services, and independent living services. And so basically with the reemployment, if the veteran, was deployed and they basically, once their deployment is finished and they want to come back and work at the same job that they were doing before, they can work with a VA and HUD counselor to work with the employer to rehire the veteran. If the veteran is merely just wanting to get back to work in another position or another type of job, they can work with the VA and HUD counselor, like I said, to do resume writing, interview prep, just to make sure that they're ready and help with assistance with finding employment. Self-employment, we work with the Small Business Administration with creating just different plans that the veteran would need to start his or her own business. The VA doesn't lend any money as far as assisting the veteran with opening up their own business, but we provide assistance and references of who they can use to open their own business. And then with their employment through long-term services, so if the veteran is able to attend school or if they have some type of need to get certifications, they can actually use this track to get those. And then finally, for the independent living, if the veteran has a severe disability and they are in need or want to live more independently, they can work with their rehab counselor, rehabilitation counselor, to help with becoming more or live more independent. Next slide. Now, this is a very important program that we have because it provides assistance to service members with assisting them with transitioning from their military service to civilian life. Now, one of the things that if you talk to any service member or veteran, One of the things that they will tell you is that in some cases they didn't know that they were entitled to certain benefits. So one of the things about the Transition and Economic Development Office is that they have transition counselors at over 300 installations worldwide. And basically what these transition counselors do is they provide briefings on VA benefits. So they cover benefits from the Veterans Health Administration, the National Cemetery Administration, and of course the Veterans Benefit Administration. Because the thing that we want to eliminate is veterans not knowing what type of benefits that they're entitled to receive once they transition out of the military. So we work with our external partners. We work with Department of Defense, Department of Labor, Department of Health, Small Business Administration, Department of Homeland Security. And so basically when we work with these organizations, we are working to ensure that all information about benefits are provided to just their stakeholders as well. And so one of the things, you know, with partnering with HUD, I know you will definitely have veterans that, you know, will come into an EnVision Center. So hopefully with the information that I'm providing you today, you will be able to point them in the right direction. Or in situations where, you know, you have an EnVision Center that's co-located in the same city as a regional office, we can have regional office staff, you know, come to EnVision Centers, you know, just to provide those assistance to veterans that, you know, come into EnVision Centers for assistance. And so our next benefit that I'll cover is dependents, benefits for dependents and survivors. Now, in some cases, people may not know that survivors and dependents may be entitled to receive benefits. Next slide. So the first benefit that I'll talk about that survivors are entitled to receive is called the Dependency and Indemnity Compensation Program, or benefit. And this particular benefit is a monthly tax-free payment to family members of a deceased service member or a veteran. So in the case of DIC, if a veteran, service member or a veteran has passed away, in the case of a service member, if they passed away in service, or in the case of a veteran, if they passed away due to their service-connected disability, their dependents are entitled to receive this monthly entitlement. And the widow or the children, in the case of the widow, she or he will receive the benefit for the rest of their life. Now, in the case that the spouse gets married, then we would terminate that benefit. But until then, they will continue to receive this particular benefit. There's also a survivor's pension that survivors can be entitled to receive. And this particular benefit is for survivors, and it's basically an income-based benefit. Again, we would look at the same information or criteria, or use the same criteria that we would use if a veteran was applying for this particular benefit. So we would also look at, of course, income. We would look at the service of the veteran. We would look at their net worth. And then based on that, we will make a determination of whether or not he or she is entitled to the survivor's pension. In the case of the Dependents Education Assistance Program, this particular benefit is for survivors and dependents' education program. So they can utilize this education benefit the same as the veteran. The only difference is in this case is the veteran or service member has passed away. In some cases, a survivor may be entitled to also receive the home loan benefit. And again, we would definitely look at, once they apply, we would have to look at, you know, certain criteria or circumstances surrounding the service member or veteran's death, or in order to determine entitlement to this particular benefit. Next slide. Now, looking at this slide, it actually discusses the changes that we went through with our appeals process. Now, in August of 2017, we had to go through an overhaul, actually, of our appeals process because a lot of our appeals were taking a long time to be processed. So in 2017, the Veterans Appeals Improvement and Modernization Act was signed into law. And so basically what that did was it allowed veterans to actually streamline their appeals process. And so they had the veteran had the ability to determine which lane, if you will be used or they can use to have their appeal reviewed. So you have the high-level review, the supplemental, and then you have the Board of Veterans Appeal. And so with this new appeals process that we've enacted, we basically have cut down the appeals process from years. Actually, we are processing them down to a little over 127 days. I think it was the last time I looked. Appeals are being processed that fast. Now, in the case of the Board of Veterans Appeals, if a veteran elects to use that particular lane, those claims take a little bit longer because the case has to be placed on a docket and it goes in front of a law judge to review. So those cases take up to a year to process. But compared to what we were doing, it's been a real improvement from what we were processing claims before. And then with this next slide, I just wanted to point out some of the things that we've been doing in response to COVID-19. And so just to look at some of the things that we've been doing, we've actually suspended the collection of debt that veterans may have accumulated. And so basically when the veteran accumulates a debt, we send them out a proposal that they're receiving benefits. We send them out a proposal to reduce their benefits, and then we'll take the necessary actions to recoup the money. But since March of this year, we have basically suspended that operation. And so we won't be renewing that until basically everything is back to normal, whenever that is. As far as claims filing, veterans can actually still file their claim as they've done before. That process is still continuing, and we will definitely continue to process those disability claims or claims as normal. In the event that a veteran needs to request an extension for submitting evidence or anything like that, the only thing that they need to do is just notify the VA, and I can provide you that information a little bit later. They can just notify us that they are requesting an extension, and that information is actually submitted as a part of their file, and then the veteran is notified that the extension, has been granted. And then also, for veterans who have to be scheduled for an exam, because in some cases when a veteran is applying for disability compensation, we may request that they take part in a compensation and pension exam. And that basically the exam just gives us an idea of the severity of the disability. So basically, we have been able to conduct these exams via telehealth, which they basically on a device, the veteran's device, whether it be their phone, their tablet, they can connect with a physician at the VA Medical Center, the person that's doing the exam. And this has actually been helpful for a lot of veterans because the process for processing their claim hasn't stopped. So this has been a very useful process for us for continuing processing the claims. And then for this next slide, I just wanted to provide you with some of the resources that we have that you can access. You know, as I mentioned, you can go to our www.va.gov, which is our Department of Veterans Affairs home site. And any type of information that you want to find about benefits and services that we offer, you will definitely be able to find that information on this webpage. We also have social media accounts. So if you want to get more information, so for example about disability compensation, we have YouTube videos. We have YouTube videos on the different benefits that I spoke about today. In the event that a veteran has questions about their claim, they can call our 1-800 number, our 1-800-827-1000. And as I mentioned, when they call that number, it will be connected to one of our 8 call centers. We also have our 1-800 number for our education processing center. And then we also have our insurance phone number as well. And one thing I also wanted to note is our crisis hotline. If you have a situation where you run into a veteran and they are in crisis, this is a very important number that you can provide them, because we have counselors on staff 24/7, 365 days out of the year. And most of the individuals that answer these calls are veterans themselves. So, again, if you have a situation where you have a veteran that is in crisis, please provide them this number so they can access that. And then finally, I want to offer my contact information. If you have a question about any of the benefits that I spoke about today, please feel free to reach out to me. There's my phone number, my email address. And then finally, next slide, we can open up for questions.
To ask a question over the phone, please press #2 on your telephone keypad to enter the question queue. You will hear a notification when your line is unmuted. At that time, please state your name and question. Once again, pressing #2 will indicate that you wish to ask a question. To submit a written question, select all panelists from the drop-down menu in the chat panel, enter your question in the message box provided, and send.
Okay, so I see a message from Stephen Brown. We can definitely get those slides to you. And I think Romel has a copy, so we can definitely get those slides to you.
As a reminder, to ask a question over the phone, please press #2 on your telephone keypad to enter the question queue. You will hear a notification when your line is unmuted. At that time, please state your name and question. Once again, pressing #2 will indicate that you wish to ask a question. To submit a written question, select all panelists from the drop-down menu in the chat panel, enter your question in the message box provided, and send. I don't see any questions on the phone line, and I don't see anything on the chat as well. Just now a question has come on the phone line.
Did you go over the vouchers for housing? So the HUD VAG program that I spoke about earlier, that program is actually operated by our Veterans Health Administration. The Homeless Veterans Program within the VHA, they are the ones that actually provide oversight over the HUD VAG program. If you wanted to get more information about a particular area, I can find out who that point of contact is and make the connection for you.
We have a couple of questions on the phone.
Okay.
Moving on to the first caller. Caller, your line is unmuted. Please go ahead.
Yes. Is there for the benefit of service-related benefits, is there a statute of limitation that once the person has exited the military that they can file a claim?
So one of the things, and that's an excellent question. Disability compensation, veterans can apply for disability compensation at any time. One thing to note when you do apply is that you provide any current medical documentation that you have and submit that as a part of your claim. Again, I would encourage you to go to the www.va.gov, and there's a section on the website that basically you can file your claim online.
Thank you.
And so, yes, you're welcome.
Moving on to the next caller. Caller, your line is unmuted. Please go ahead.
Hi. I just wanted to know if there was a way in which we could receive your contact information via email.
Oh, you wanted my email contact information?
Yes, please.
It's Julian, Julian, dot Wright, WRIGHT, the number 2, at va.gov. And my contact information is also a part of the slides, and I think Romel is going to make sure everyone gets a copy of the slides. So you'll also be able to find my contact information there as well.
Thank you.
You're welcome.
There are no further questions on the phone.
So just closing out, I definitely want to thank Christopher, Romel, Jill, with inviting me today. I hope you all got some useful information from my briefing today. Again, if you have any questions, feel free to reach out to me. Again, my contact information is a part of the slide deck, and I just thank you all for what you do for your clients, and anything that you can do or need from me on my end, just let me know.
Julian, thank you so much for presenting today. I really do appreciate your time. And again, we also appreciate your service to our country. I do want to also echo something you mentioned during your presentation, that Indian veteran homelessness is still a major priority for HUD. So anything we can do as an agency to assist with that, please let us know. We're happy to work with you on that. To all our Vision Center and HUD staff across the field, thanks again for your time. We will get the slides out to you, and feel free to reach out if you have any questions. Thank you so much.
Thank you.
That concludes our conference. Thank you for using AT&T Event Services. You may now disconnect.